Hello, everyone, and welcome to episode 71 of the Ortho Eval podcast. I am your host, Paul Marquis. Today, we are going to be talking about shin splints, pain in the anterior tibial region, and what to do with it, where it comes from, and how to manage it. Hopefully, we're going to keep this on a level that's going to be easy to understand. Although it can become very complicated, we're just going to kind of break this down, give you some key pointers that are going to make, hopefully, understanding this a little more fruitful and help you get to treating your patients a little bit more efficiently. But before we get started, I'd like to take a moment to hear a word from our sponsor. Welcome back. Oh, my word, shin splints, such a common term used by so many people for so many different problems. And it's kind of a generic term. So we want to break this down a little bit, see if we can isolate a little bit more. Not all shin splints are treated like the same. And really, shin splints is just a general term that describes, medial tibial stress syndrome. So, anterior and medial tibial discomfort is very, very common. We see this most often in younger folks, usually in the athletic population. We do seem to notice it a little bit more in those with a little higher BMI and those with a little lower bone density. So, who are some of the high risk people? It's those folks. Plus, I've also seen a huge incidence of medial tibial stress syndrome or shin splints with people who have tibial verum. Okay, so there's a little bowing of the tibia, not just at the knees and in the femur and tibia combined, but just in the tibia. When you have that tibial verum, the stress is placed medially when you strike the floor, and then the arch collapses harder. Anytime that arch collapses harder, anything supporting it can work eccentrically too hard and cause some issues. So where do these issues come from? Well, oftentimes, if you're overstressing or overusing the leg, you'll develop some excessive amount of pulling on the periosteum of the tibia. Okay, now there are several muscles that attach there. So let's start with the first one, which is something we see quite often. It's the posterior tibial tendon. Now, that posterior tib, what's its job? That's the first thing you need to think about is, where are they tender? Are they tender to the medial aspect of the tibia and sometimes just a little bit behind that? Make sure, too, when you're palpating these folks that you check left to right. Okay, because some people are very tender around the tibia, and that's not uncommon, especially if they have a broad periostitis. And just people in general are tender there. So I would make sure that when you're palpating, you know what tissue you're palpating. So if it's a posterior tib, follow that tendon. Start at the navicular and then work your way up around the medial malleolus. Follow that tendon up to the medial aspect of the tibia and see how tender they are there. The other thing you need to remember is that the posterior tib tendon is a supporter of the medial arch, and it also inverts and plantar flexes the foot. So test that. Have them plantar flex and invert the foot and give them some resistance and see if that increases their pain. Have them go through motion when you test that also, okay? And that can help to diagnose this. These people who have a proximal origin situated posterior tib tendonitis or shin splint, they do well with an orthotic. Okay, you also have to wonder, why are they collapsing? Is it because they have to turn their legs out a little bit, okay, or retrovert the hips to clear the feet better because their calves are so tight? So almost all of these people I see are on a calf flexibility program. We will also work on some, strength training, but we'll talk about that a little bit later in the show. The anterior tib is also a stabilizer of the medial arch, okay? It helps to decelerate the foot. Once you strike the heel, the anterior tib has to work really hard to help hold that foot from slapping too hard. So people who are starting to maybe like up here in northern Maine where 8 months out of the year you can't get outside and walk, so they might start walking on a treadmill. People who walk on a treadmill are at higher risk of having anterior tibial tendonitis issues because the belt pulls the foot into plantar flexion a lot faster, and you have to work harder eccentrically to slow the foot down. All right, so ask them that question. Have you had a change in shoe wear? People who go from a soft heel to a harder heeled shoe will have more problems. And so you want to ask those questions to see if that, or what's the surface that you're training on? Has that changed? So that's a common irritation. Okay. The anterior tibial tendon or muscle will pull on the tibia, cause some irritation there. What else here? So you can have those issues. I think what I'm going to do is, before we continue on, we're going to talk. We're going to take a break. We're just going to hear from our sponsors, and we're going to talk a little bit about stress fractures and the soleus involvement here, which I think is huge. And we'll talk about how do you treat these things. So if you don't mind hanging on for a second, we're going to hear a word from our sponsor. Hello, everyone, and welcome back. We're talking shin splints today, a loaded diagnosis, something that can be very complicated, very difficult to treat. These people who come in with shin splints, if it's usually if it's female, we see it more in females, but if we do see them in females, I might ask them if their natural hair color is what it is. We do notice that people who are blonde hair, blue-eyed, freckles, people who sunburn really easily, those people stress fracture a lot easier and end up with periostitis type issues. People with vitamin D deficiencies also seem to have more trouble with that. So these are all little things that I look at when I'm evaluating these people if I'm suspicious of some sort of medial tibial stress syndrome or shin splints. Let's talk about stress fractures a little bit. This is very complicated. Not all stress fractures will be picked up on an x-ray, but I do think it's important to identify if these shin splints are becoming chronic, if they're becoming more painful, and they're not really responding. Palpate not only the medial and lateral ridge of the tibia, but go right on the center of the shaft of the tibia. See how uncomfortable they are there. You may use a tuning fork over the area. That can sometimes cause some irritation if they have a stress fracture. And sometimes even doing a pulsed ultrasound over the region that's going really, really slow can cause some irritation at an area that is kind of stressing a little too much. It's important that you identify these because there's nothing worse than having somebody go out and actually fracture when they're in a race or if they're putting that leg under a lot of stress. Oftentimes, we just need to rest these people really well. Bone density tests, or not bone density tests, but bone scans can be difficult to help identify this. Bone scans can come up hot, even if they have just inflammation or general periostitis. Sometimes it requires an MRI, and we've seen some of these this year where the MRI really identifies that fracture before it happens. And so that's something you should take a look at. And, sometimes you need to totally immobilize these people, and they need to be out of sports, out of activity, and take a rest. I would check the vitamin D levels and, see what that's looking like also. Now, let's talk about the soleus. I think this is really a bigger culprit than any other, issue in shin splints. The soleus, works when the knee is bent. It helps the plantar flex the foot, but you need to remember where the Achilles and soleus insertion is. It is on the retrocalcaneal tubercle, but a lot of those fibers attach medially on the calcaneus. So every time that calcaneus strikes the ground, and if it goes into valgus, it's going to excessively load the soleus because the soleus is trying to support it and keep it in a more neutral position. So eccentrically, the soleus is working very hard every time you strike the ground. And so if you have, an excessive amount of calcaneal eversion or valgus to the calcaneus, your soleus is going to work a lot harder. And that can give you a lot of shin splint discomfort. Now, shin splints are different than having compartment syndrome. Compartment syndrome will give you numbness. It'll give you, pain that'll last after activity for about an hour. Then it will go away. Then you'll be able to resume all the rest of your activities. They do present a little bit differently. But as far as treating these issues, it doesn't matter really if it's a soleus issue, if it's a posterior tib tendon irritation, anterior tib tendon irritation. It all comes down to a couple things. Is that heel moving excessively? Okay, is there too much load? If the heel is going into a valgus too much, you want to try to stop that. You want to support that. I'm a big advocate of orthotics only because you can cup the heel and support it. You can also support the medial arch and not allow that medial arch to collapse as much. If it's not collapsing as much, both the anterior tib and the posterior tib are not working as hard. The soleus is not going to have to work as hard, and therefore not eccentrically load and stress the periosteum of the tibia as much. I'll take these people and I'll throw them into their old sneakers. And I know we just had an episode about old sneakers. Well, this is a situation where I've had actually really good success treating patients acutely with these shin splint issues by putting them into an old pair of sneakers, only because if the heel is really soft, the foot is not going to tend to plant or flex as quickly, and then therefore you don't have to work on eccentrically loading as much to slow the foot down. So I have seen this work really well with patients. Now, we don't do it forever, obviously. And then sometimes, putting a temporary orthotic in there, and if they need to get to a custom orthotic, then that's fine. Also an advocate of compression. I like a good compressive stocking for these folks just to act as a counterforce and to prevent swelling in the lower leg. And this can be very, very helpful. Now, there are modalities that can also help, but this is really more of a biomechanical issue. All right. If the foot is collapsing medially too much, I am a big advocate of strengthening the hip abductors to prevent valgus at the knees and excessive pronation of the foot. I think that it's important to start loading the anterior tib, posterior tib, soleus at a reasonable time to just try to help increase the integrity of the tissue and also to help rebuild, those medial arch supporters. So, there are many factors in treating stress syndromes and medial tibial stress syndrome and shin splints. But take a look at a few of those things. Just take a good look at the foot and see if any of these muscles are working eccentrically a little bit too hard. Take a look at the factors that I told you were contributors and see if maybe there's an issue going on there. But don't let these go on too long because they can turn out to be disastrous. Oftentimes, a little bit of rest and good diet and hydrating well and all these things can really help to treat these problems. So there's my tidbit on shin splints. If you have any questions, would like to throw out anything in regarding how you like to treat shin splints, please let me know at orthoevalpal.com. Go to our Get in Touch page and leave me a note, and I will most certainly get back in touch with you. So again, folks, thank you for listening. I hope you're enjoying the episodes. I certainly enjoy doing this, and we'll continue here with a few segments on the foot and ankle. And I think I've even got some guests who will be coming in and really talking about some interesting stuff. So make sure you stay with us. Thanks again.